Perfect, thank you. Ladies and gentlemen, once again, good afternoon. My name is Martin. I am a health fellow at GLOBSEC. Yes, and my clicker doesn't work for some reason, so I will just probably wait for it to start working. Anyway, in the meantime, the GLOBSEC is a think tank focused on enhancing security and resilience in Europe. COVID-19 clearly demonstrated that security is not just about tanks and drones, but if a healthcare sector in a country fails, everything actually eventually collapses. And for this reason, in 2022, we expanded into healthcare. Yes, thank you, it works now. We expanded into healthcare since we wanted to have a look at what made some countries more successful than the rest at dealing with COVID-related issues. However, while we're working on that, we realized that even though most countries had not yet recovered from COVID-related issues, most of them are soon to face another set of challenges associated with aging and rise in non-communicable diseases. The malicious thing about the aging and NCDs is the fact that their impact is more slow and silent, so it's often off-radar to politicians and decision makers, and therefore they are often ignored. We at GLOBSEC, we want to make sure that this does not happen, and our goal is to actually remind policymakers to make sure that they build the healthcare system now so we are ready to face future challenges when the time comes. In order to do so, we've prepared a simple tool that we believe will help the decision makers to be ready to act when it is needed. This is a very simple yet powerful tool. It is a ranking of performance of healthcare sectors of every single member state of the EU, which enables decision makers, stakeholders, basically everybody to have a look at the results of the healthcare system, identify best practices, and hopefully eventually improve the resilience of the healthcare system. We call this initiative the Healthcare Readiness Index. The first index was published in 2022, and today I'm pleased to present you the findings of the 2024 index, which was published just a couple of days ago. Before that, I have just a few words on methodology. Right? Just very few because it's a bit complex, but basically we looked into more than 100 different indicators, out of which we selected 38, which we then measured, weighted, and presented as a composite score ranging from 0 to 100. The higher the score country has, the more ready, the more prepared the healthcare system it is. So very simple, the higher the score, the better are the results. So if we look at the results, you can see, we probably can't see, but I will tell you the most important thing, that the countries with most ready healthcare systems are Sweden, followed by Netherlands, Denmark, Norway, and Germany. 9 out of 10 least performing countries are countries from the CE region, the only exception being Greece. Greece, in most cases, due to the fact that are still recovering from the financial crisis. The 3 least performing countries, or as we call them, countries with highest potential for improvement, are Bulgaria, Romania, and Poland. We could spend hours discussing actually the drivers behind these results, but the most important notion, the most important takeaway point is that a chain is as strong as its weakest link, and if we want to ensure that EU remains competitive against other regions such as China and USA, our job and objective need to be how can we close the gap between the highest of the best performing countries and the least ready countries, since the level of health outcomes are directly related to the productivity, GDP growth, and eventually to competitiveness of not only member states, but the EU as a whole. So the question is, how can we close this gap? And well, what can we actually learn from the best-in-class countries? The best-in-class countries share several common traits. Due to time constraints, I just picked 3, which I find most, not important, but most often not sufficiently used and utilized by the least performing countries. First of all, the best performing countries tend to perceive healthcare expenditure not as a cost, but as an investment that will return the investment with some extra benefits through increased productivity, longevity, eventually GDP. This is the reason why when we look into spending per capita PPPs, 4 out of 5 highest spender in Europe are countries from the best-in-class box of our index. Of course, it is not only about the level of investment, it is also about the efficiency and structure. And for this reason, I guess I won't surprise you that once again, 4 out of the 5 highest spenders on prevention in Europe per capita are the countries from the best-in-class box. The blue line shows the spending in 2024, the gray in 2019 is because some countries' data were still skewed a bit by temporary expenses due to COVID. The reason why these countries spend so heavily into prevention activities is simple. These countries tend to invest now to save later on. It's as simple as that. However, it is not only activity of the best-in-class countries focused on prevention. Basically, they build and focus all of their activities around the notion of public health. This ranges from processes, infrastructure, and other elements. And my clicker doesn't work anymore. But I will show you in a couple of seconds. Once again, we focused on several interesting indicators, such as the number of CTs and MRIs, which illustrate the capacity of diagnostic capacity of countries. And yes, thank you. As you can see on this slide, once again, the best performing countries are dominating this index. However, these countries focus on all aspects of prevention and public health, ranging from management of behavioral determinants of health up to levels of vaccination. And this is one of the illustrations of factors and elements that we use in our publication, which is the coverage of HPV coverage, vaccination coverage of HPV of girls under 16. Once again, as you can see from the illustration, the countries which dominate our index, such as Norway, Sweden, Denmark, Netherlands, are also very high on the level of vaccination, not just the HPV, but also against influenza and other forms of diseases. Third common factor is that the best-in-class countries tend to, we call it, embrace innovations. And this is something which is very difficult to measure. However, there are proxy indicators, especially thanks to FPS, average availability of medicines and time to availability, which you can see on this slide, which measures how many days it takes for a country to reimburse a new product on, well, average. And as you can see, the best-in-class countries such as Germany has the average time to availability 128 days, Denmark 339 days, the average of CE countries, which are unfortunately at the end of our readiness index have average time to availability roughly 700 days. The reason for this is that the best-in-class countries tend to have more fair, more transparent, more advanced processes, which enable on one hand more rapid, yet still sustainable adoption of innovations. There is one more factor I wanted to mention, which is something that is extremely important and critical, but very difficult for us to influence, which is a leadership stability, which can be measured by looking at average tenure of Minister of Health. In other words, how many days, months, or years average minister stays in his or her office. Once again, as you can see, there are big differences between the best-in-class countries and the least performing countries. And this is a very important indicator because the longer ministers have chance to be in the office, the more opportunities they have to focus on long-term projects, reforms, rather than focusing on transactional, short-term issues and projects which are important but will not deliver the value when it is needed. This indicator is actually so important and so significant that if you look at the very simple visual correlation of the average tenure, which measures how many years on average a minister stays in his or her office, and the overall results of our index, you can see a very clear correlation. And the reason for this is very simple, is that continuity leads to progression, instability to stagnation, which can be seen on the overall results. To conclude my very, very brief presentation, I have just 3 points. First point is that if we want to ensure that EU remains and stays competitive, we need to build on our healthcare system. Reason for healthcare systems. The reason for this is that the healthcare systems and the quality and health outcomes directly influence productivity, GDP, and eventually competitiveness of not only member states, but the EU as a whole. We are fully aware that the recent changes in priorities actually shifted the focus and resources elsewhere, which is fully understandable due to war on Ukraine. However, if we are to be prepared to face the future challenges, we cannot hesitate, we cannot postpone it. We need to build and expand our healthcare systems now. And thank you for listening.
are united in diversity. We are very heterogeneous in our opinion.
We are doing this in our open democracies. Discussion is all open and loud, and I'm not for that.
What is European Union? What is freedom? How we learn together?
The obvious question is, what is the EU doing? What is our plan?